how much does the staffing issue feed into the sustainability issue relative to complete? I mean, and I know completing work, just hitting these goals of 2030. Do the two interact, and if so, how do they play together or compete
absolutely
against each other?
No, I mean, if you like, again, I've got staff who can dedicate time to being focused on it, and then and also drive initiatives towards it. If you are a typical hospital out there who's running on a shoestring on their facility side, the director is the one who's setting the capital plan. The director is the one who's looking at the emissions. I mean, all of that stuff falls on that one person. There's only so many places they can do. And so only so many things they can really focus their time on. And back to what we said before, our job is to keep it running so we can provide patient care. And that other stuff out there, I'd love to be able to do. And I may have a passion for sustainability. Well, that means then I'm going to not do something else. And maybe that's not growing my team like I should, right? Or not being as engaged on the patient side. But it's all a give and take. And there's only so many hours in a day. And having the right team that can have the time to focus on that is the only way that's going to be successful. I've worked in those critical access hospitals, and they you do it all. And when you bring up this forward thinking, what we're going to do in 5 years, like, dude, I don't know what I'm going to do tomorrow. And try to get, I think that's the other challenge when you look at all of the bulk of the hospital square footage in this country are those critical access hospitals, and you're asking them to operate like I can, because I have that luxury, and they don't have the ability. Not that they don't have the drive or the want to. You just don't have the resources to do it. I have time to think about things that other people don't have time to think about, because I got other people thinking about things I used to think about.